Selected muscles of the head, neck, forearm, and lower leg will be shown using human models. The orbicularis oculi tells you that it goes around the eye. It orbits the eye. This is a sphincter muscle. When these muscles contract, it's going to close an opening. In this case, it will be the opening around the eye. So this muscle helps you wink or blink. The zygomaticus is going to extend from the corner of the mouth to the zygomatic bone. When this muscle shortens, it's going to elevate the corners of the mouth. This is your smiling muscle. The orbicularis oris is the circular muscle surrounding your mouth. This is going to close your lips. This is your kissing muscle. The large muscle that is part of the cheek is the masseter. This assists with jaw closure and helps elevate the mandible. And then higher up on the head we have the temporalis. This is attached to the temporal bone. It extends down to the mandible, so it's involved in closing the jaw, and it elevates and retracts the mandible. The sternocleidomastoid muscle is a large muscle in the neck. When this muscle contracts, you flex the neck. You pull the head forward. As we begin to look at the lower arm, you need to orient yourself. This is the palm of the hand, so this is the anterior surface of the arm. All of these muscles are going to be involved in flexion. In order to orient yourself, find the tendons that come from the fingers and follow them up to this central muscle. This muscle is the palmaris longus. You'll remember that the radius is the bone on the thumb side of the hand. If we go one muscle over, we have the flexor carpi radialis. And if we go one muscle toward the little finger side, we have the flexor carpi ulnaris. The palmaris longus is a very weak wrist flexor. It tenses the skin and the fascia of the palm. The flexor carpi radialis flexes the wrist. It will also abduct the hand. Now, to understand hand abduction, stand in anatomical position. When you bend the wrist so that the hand is pulled away from the body, that is abduction of the hand. The flexor carpi ulnaris flexes the wrist as well, but it's going to adduct the hand. When this muscle is activated, it will pull the hand toward the body when you're in anatomical position. We are now looking at the posterior side of the arm. All of these muscles are going to have to be extensors. Again, to orient yourself, find the tendons that come from the fingers and follow them up to this central muscle. This is the extensor digitorum. If we move one muscle over to the radius side, we have the extensor carpi radialis. There are really two muscles here, a longus and a brevis, but just know both of them as the extensor carpi radialis. And if we move one muscle to the little finger side, we will be in the extensor carpi ulnaris. The extensor digitorum will extend the fingers. It also extends the wrist. When we activate this muscle, we will also spread the fingers apart. That's finger abduction. The extensor carpi radialis will extend the wrist and will help abduct the hand. The extensor carpi ulnaris will extend the wrist and help adduct the hand. There are two additional muscles in the lower arm, the pronator teres and the brachioradialis. The pronator teres is next to the flexor carpi radialis, and the brachioradialis is next to the extensor carpi radialis. The pronator teres will pronate the forearm. The brachioradialis is a synergist to forearm flexion. Here you see the lower leg. You'll remember that this bone is called the tibia. So this muscle right in front of the tibia is the tibialis anterior. Next to it we have the extensor digitorum longus. Notice how these tendons go to all of the toes. The tibialis anterior is involved in dorsiflexing the foot and inverting the foot, turning it inward. The extensor digitorum longus dorsiflexes the foot as well, and this one extends the toes. Looking at this side view, and this is a lateral view, we still have the tibialis anterior and the extensor digitorum longus. This muscle is a group of muscles called the fibularis or the peroneus muscles. The fibula is the lateral leg bone, and this muscle surrounds the fibula. We then have this very flat muscle called the soleus and this large bellied muscle called the gastrocnemius. The fibularis or peroneus muscles are involved in plantar flexion of the foot. Also, because they're on the outside, they will help evert the foot or turn the sole outward. The soleus plantar flexes the foot. The gastrocnemius, which is the large calf muscle, has its origin on the condyles of the femur and its insertion on the calcaneus. This is going to cross both the knee joint and the ankle joint. As a result, it has two motions. It's involved in flexing the knee and plantar flexion of the foot. As we turn to the medial view of the leg, here's the gastrocnemius and the soleus, and this muscle right here is the flexor digitorum longus. These tendons are going to come down and go across the bottom of the foot to the toes of the foot this way. The flexor digitorum longus will help plantar flex the foot and invert the foot. It will also flex the toes.